Polycystic kidney disease, or medically called as autosomal dominant polycystic kidney disease, is a type of kidney disease which is affecting almost 1 in 500 to 1 in 1000 individuals worldwide. It is one of the most common reason for kidney failure in the world and considered as the 4th largest reason for kidney failure. In this disease, which is basically inherited genetically, that means it comes through the parents. So 90% of the patients will have a history of having a kidney problem in their parents or someone who is closely blood related. It is a dominant disease, so almost 50% of the children may get affected because of the dominant nature of the genetic disease. Most of the time the PKD presents between the age of 30 years to around 70 years of age, depending on which type of polycystic kidney disease the patient has inherited. PKD1 inherited is because of the polycystin 1 gene, and PKD2 is because of the polycystin 2 gene, and PKD1 presents early, somewhere around 30 years of age, whereas the PKD2 presents late, roughly between 50 years to 70 years of age. But sometimes the PKD can even present early in certain individuals. Most of the time the PKD or polycystic kidney disease is diagnosed on a routine ultrasound done for some other regions, or some CT scan or MRI which has been done for the abdominal examination due to some unrelated disease, and the patients are usually picked up. Most of these individuals will present with some kind of pain in the loin, or some kind of infection in the kidney, or sometimes bleeding in the urine. Very rarely the patient may present into advanced kidney failure with lot of uremic symptoms, but this is not very common. Normally these cysts start developing at the age of around 20-25 years of life, but initially they are very small in size and small in number, so the symptoms are not perceived. But after certain time, when the cyst numbers increase, the kidneys enlarge in size, and with that the symptoms start appearing. Kidney failure may happen at the age of 35 to 75 years of age, depending on what kind of kidney disease the patient is having and what other factors are affecting on the kidney. Many a times the patient may present with some other organ disease like liver having multiple cysts leading to liver failure, or sometimes brain hemorrhages because of the aneurysms which may be seen in these kind of patients. The patients may also have heart failure or valvular heart disease with symptoms pertaining to that, as these are associated with the polycystic kidney disease. The treatment is not available as because these are genetic diseases and cannot be prevented. So most of the time the patients are counseled to avoid painkillers, have a good diet, take less salt in the diet, control their blood pressure, and sometimes we have some drug, a recent one which is called as tolvaptan, approved by the US Federal Drug Agency, which is being given to prevent the progression of a disease. However, most of these patients may land into kidney failure at some point of time and will require dialysis or a kidney transplant. So in a nutshell, I would say that polycystic kidney disease is a genetic disease, affects many individuals across the world, and is one of the leading reasons for kidney failure. And the disease progression can be retarded by certain measures which can be taken when they are first diagnosed. So any individual who has got a polycystic kidney disease should reach out to their doctor and take the medicine so as to retard the progression to kidney failure. Thank you so much.